demo here just to show everybody. So, you know, the 2 cylinders, and so these would be in the penis. There's the pump right here, and so we try to surgically implant that in between the testicles in a kind of a place in a concealed spot. So, and then this reservoir, and this one has air, but this one, the real one, we put some saline in it and tuck it in the abdomen. So the key is, if you're in a locker room, no one will know you have it. It's fully internal. There's no part of this that is external. It's safe in an airport metal detector, safe in an MRI machine. So it's you know, it's a great option in patients who maybe have failed a lot of the medical management of erectile dysfunction, and it's something to think about. And there's even newer things that are always coming about in our field. This is why it's, you know, so interesting and why I love my job the most. I think it's so gratifying because, for instance, one condition, again, this is really applicable to today's audience. Some patients, when they are having sex, they will leak. That's called climacturia, right? So when they climax, they leak urine. So now there's a newer procedure that we do when we put in the penile implant. We'll put a sling in at the same time, a little different the way I showed in the slides, across the penile implant. So when you pump up the implant, it tightens that, and so across the urethra, so the patient won't leak during sex, right? So we are always innovating and finding new avenues that we can help just patients who are struggling. So my take-home message tonight, before we get into the Q&A, is please go see your local urologist. Let us kind of, you know, help and you know, do what we love doing, and just really getting the word out there, and just treating patients who are suffering, and so here's a demonstration of the penile implant. So we'll just put that on too. Okay, so first thing you see, it's fully concealed, right? So it's nothing external, but now when you kind of look inside, so the pump is right there in between the testicles. So the patient will pump it, and what it's doing is pulling the fluid from that reservoir into the penis. Nice erection. You can stay hard as long as you want, whenever you want. There's no such thing as a priapism with this. You know, it's not going to stay too hard. And then you press the deflation button, and it goes down, and that returns the fluid back to that reservoir. And the reservoir is non-palpable, meaning you can't feel it, but it's as easy as that. So it's an outpatient procedure. It takes an hour to do. You go home the same day, and then we see the patients a few weeks later to show them how to use it.
If you'd like to learn more about post-prostate cancer treatments, there will be more resources in the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. As I previously mentioned, if you have another question, or if your question was not answered tonight on the call and you'd like to follow up with someone in person, you can do so by calling MenMD at 857-233-5837. Or if you prefer, you may log into the password-protected MenMD portal to schedule an appointment with a MenMD personal health assistant. If you're interested in purchasing any of the ED or urinary incontinence products that we mentioned tonight, this is going to be over-the-counter products, as the other ones would require prescription, but you can do so by heading to the shop page on menmd.com or by calling our office again at 857-233-5837.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.